Do you often been asked that you look sleepy and tired? Do you feel your eyelids have fallen down? This is Dr. Shubhra Goel. I am an oculofacial plastic surgeon with Apollo Jubilee Hills, Hyderabad. Sleepy or tired eyes are nothing but droopy eyelids. Droopy eyelids is when our eyelid actually drops down from its normal position. Why does it actually happen? It can happen from birth because the muscle which lifts your eyelid has not actually developed. Or it can happen as you grow up. And the various causes could be a previous surgery, an injury, or an age-related changes in the muscle which makes it weaker. In addition, some of the patients can have neuromuscular disorders, meaning the supply from the brain to the muscle is not efficient, and that makes the muscle weaker. So when any of these things happen, the lid, which is supposed to be sitting at a position which is on the top level of a black portion which is cornea, it actually comes down. And when it comes down, there are the following things which happen. One, the patient's look changes. He or she looks tired, sleepy, not so awake. He or she would have difficulty in vision, and especially in children, if it's from birth, they can have lazy eye. And when you look down, actually the lid can cover the visual axis. In severe cases, it can actually also cover the lateral portion of your vision, and that could be dangerous. A lot of times there is a misconception that this is a cosmetic treatment. Yes, it could be a cosmetic treatment, but in most of the cases, it's a functional treatment as well. Because what we are planning or we are aiming to do is to lift your eyelid up to a position where your visual axis is clear. And of course, in turn, your eyes look normal and they look in their normal position, and hence the cosmetic treatment. How is it done? Mostly it's a surgical procedure. It doesn't get corrected on its own. A lot of people come to us and ask us, will it get okay by its own? No, it does not, because it's a structural problem. So once the specialist, which is an oculofacial plastic surgeon, assesses your eyelid, finds out what is the cause of it, builds the algorithm around it, there are different procedures which can be done. These are day care, minimally invasive procedures. Recovery time is usually a week. There are no scars or minimal scarring which heals over a period of time. And the success rate of these procedures is almost 90 to 100%. So if you have a droopy, sleepy or tired eye, the way I explained, please reach out to your oculofacial plastic surgeon, get it sorted and get it treated.